I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we are going to go over pain standing up after sitting. So this is a pretty common thing that people come in with here. One of the common complaints that I hear is if I sit for a while and then I go to stand up, I look like my grandmother and I have to kind of do one of these, and then I have to stand up nice and slow, and I have to take my time when I'm standing up. If I sit for too long and then I go to stand, I get pain in my back. I get pain in my lower back. So these are, I'm going to go over just a couple things you can do to actually eliminate that pain. That pain is not normal. It doesn't mean you're getting old, even though we all are. Hate to break it to some of you, but yes, we all are aging. But that pain when you get up, or that pain that you have when you stand up, or that pain that you have when you get out of bed in the morning, that's not normal, and there are certain things that you can do to eliminate that, and we're going to discuss that tonight. But first we're going to kind of go over why you have that pain when you sit down. So your muscles act like pumps. So when you're sitting, and you know, a lot of times people will come in and they'll say, you know what, Dr. Moore, I have pain after I stand up, and I have this sitting desk, and it's all, you know, done in correct posture, and it's, you know, it was set up by a nurse that's on staff, and yada, yada, yada. So I don't understand. I should be able to sit there as long as you can. Well, what happens is your muscles, here's your back muscles. Yes, my very elegant drawings. So here's your back muscles when you sit, okay? And when you move your muscles, they act like pumps. So when you move around, whether you're fidgeting like me and you're standing up, or, you know, even if you're fidgeting in your chair, anytime you move, your blood is going to flow in. It's going to bring increased blood flow into the area that you're moving. Not a ton. You're not going to notice swelling or anything like that, but you are going to get increased blood flow into those muscles. So as you're moving, as you're standing, as you're walking, there's this cycle of blood going in and out of the muscles, in and out of the muscles. It's just like taking a breath. You're like, ah, that's the same thing with your muscles. It's fresh blood in, out, in, out. So a lot of times, you know, you've heard me talk about if you move, you actually wind up decreasing the pain. If you gently move, doesn't mean go run a marathon, but if you gently move, it's going to wind up decreasing the pain because of the fact that that blood is going to be able to circulate through the muscles. So when you sit for long periods of time and you don't get up and you don't move, what happens is there is no blood that goes to those muscles. So as you sit and your muscles are just sitting there and they are craving this blood, okay? So a lot of times you'll feel like I just have to stand up. You can't, so you force yourself to sit down. That feeling of wanting to stand up is your muscles asking you to please give us a little blood infusion. Please allow some of this blood that's stagnant to get out of here. So when they sit here and they're this length for this long and nothing is coming in, nothing is going out, and they're just zoned out, 90% of the time they're zoned out in the wrong posture, but if they are even in the correct posture, there's nothing flowing in and out. So they are actually the for lack of a better term, don't get on my case because this is not medically correct, but just the water and the fluids that are in the muscle just start to trickle out. So if you could picture a dehydrator that's dehydrating fruit, that's what's happening. There's nothing coming in, but you're sitting there and you're compressing your joints, you're compressing your muscles, you may be stretching them out. Whatever the case may be, you're just dehydrating those muscles. You're just winding up taking the fluid and allowing it to trickle out slowly. It's why if you sit for maybe a couple minutes, 2-3 minutes, you stand up, you don't feel any pain. Now, if your back pain is far gone and it is bad enough, you may only be able to sit for 2 or 3 minutes. You may only be able to sit for 30 seconds without feeling pain. But if you are just starting to feel this and you just start to feel like pain with standing, you're going to get at least a good maybe 10, 20, 30, 40 minutes, an hour where you're able to sit. This fluid slowly trickles out of your muscle. You wind up with a little dehydrated muscle there, and when you go to stand up, all of a sudden, You're asking something that's completely, you're asking a dehydrated muscle, like a little dehydrated apple, to contract as hard as it can. So when you go to stand up, you're asking all of this blood and fluid that's being shunted away from the muscle to all of a sudden quickly come back in. Give this muscle blood. So when you go to stand up and you have, you just sat down, it's only been a couple minutes, and you go to stand back up, there's no big deal because that rush of blood that comes into the muscles has not really stopped. Okay, that muscle is still pumping a little bit of blood. Even if you sat still for 2 or 3 minutes, it's generally still continuing to pump as it slows down and stops. So when you go to stand up and there's that giant tidal wave of blood that rushes in, it's not a big deal because you have some blood moving through. But what happens is, when you take a completely dehydrated muscle and you flood it with blood, you can't handle it. So you're just asking a muscle that is dehydrated to accept this ton of blood flow. And it's not able to do so. And it's not because of the blood flow that you have pain, it's because the muscle is so tight, it's so dehydrated. So you go to stand up, and then you're all of a sudden like, just give me a minute, all right. What's happened is your muscle has slowly, in all the stages of okay. It's your muscle accepting that blood, allowing for that muscle to become undehydrated, allowing for the fluid to start to flow, and then you're able to stand up. Some people even start to do a little bit of this. You're like, okay, all right, and you slowly become more upright to the point where you can walk again, and it feels good. That slow raise and that slow walk allows the blood to infuse into the muscle until all of a sudden you're like, all right, I can walk again. I can walk normally. So clearly that's not normal. Not usually, it is a sign of something going wrong in your back. So what that is usually muscle related. And you can sign up for one of our seminars or go to one of our other YouTube videos and we talk about some of those things. We're not going to get into that tonight. But if you have pain after sitting for a while, it's not normal. It's not normal. It's not something you're just like, I'm getting old. It's normal. It's not in any way normal. It's usually the first sign something's starting to go wrong in your back. So just be aware of that. So what are you supposed to do? You got to sit for work. You got to sit on an airplane. What are you supposed to do when you know that if you stand up, you're going to have back pain? So the first thing you're going to do is you're going to fidget. I know, really complex, really hard, really descriptive medical term. But all you're going to do in a chair is cross and uncross your legs, okay? Sit forward, sit back, fidget. The more you fidget, it doesn't necessarily make everything better, but what you do is you allow that blood to keep moving into the muscle. So you're not stopped, you're not dehydrated, you're not stopping the blood flow into that muscle. You are allowing those muscles to keep a nice steady blood flow as you fidget. How often do you fidget? You don't stop. I know, it's a pain in the butt if you are trying to get work done. But it doesn't have to be a massive ordeal. You sit like this, and then you move like this. You're still working. You're still getting things done. You move forward in your chair. You move backward in your chair. Things like that, all right? So fidget, it doesn't have to be anything specific, but try to keep moving, okay? And honestly, like just sitting here and tapping your toes is not doing anything. So if that's what you consider fidgeting, that's not fidgeting. You've got to somehow get your back involved and move. And I'm talking about this, for people who are stuck on planes and conference rooms and things like that. That type of activity is a little bit more difficult to do if you are stationed and you're looking at your doolies and you're trying to get work done. It is harder to cross your leg and shift from side to side. So what else can you do? in order to eliminate this pain so when you stand up you don't have it? Well, the most obvious thing is stand up more often. So a lot of people tell me they can't stand up. I'm not really sure I agree with that, but if you're able to, and you can set an alarm, even if you just like, you know, it doesn't take a whole lot. You just have to stand up and sit back down. So if that's not possible, the second thing is you're going to do pelvic tilts. So again, this is only if you're stuck in a chair for a while and you're not going to be able to get up and you have no way to stand up. What you can do is, all you're going to do is just slump back and then come forward. And then slump back and then sit up nice and straight. You may feel a little bit of stretch in your low back just by doing this. If this causes numbness or tingling that goes down your leg, you are not to do it, okay? But you're just going to slump down and then sit back up nice and easy. Slump down, sit back up nice and easy. This is something that you can do if you're stuck at the computer. You know, you can do it. Set an alarm on your computer so you're able to do it, so you don't get in that zone where you're, you know, wired in for hours and hours and hours and you aren't able to, you know, take a break and you aren't able to do some pelvic tilts. But those are really going to help allow that back to loosen up because it's going to keep that blood flow continuing to go into that low back area, and it's going to be able to allow that muscle not to become dehydrated, which is really the ultimate goal, which is really why some people look like they're 90 years old when they stand up. And the final thing that you can do to eliminate this pain when you stand up is you can cross your ankle over your knee. So the third is cross your ankle over your knee. And lean forward. Now this one is actually doing a direct stretch. So if you are sitting down, cross your ankle over your knee, sit up nice and straight, and lean forward. You're going to feel a stretch with this probably in your butt, in your hamstring, maybe a little bit in your back. All right? But this is one of the things that you can do, and you can switch up, and it'll help loosen your back up a little bit. And it'll help keep that back moving. And it'll help keep the blood moving. You want to hold this about 30 seconds if you are going for the stretch. If you're just going so you can loosen your back up and keep the blood flow going, then just keep going back and forth like this. If you're in a meeting, this is what you can do. You can sit back. You can sit up nice and easy. If you don't have the ability to stand up, shift your legs around. Cross your legs, lean forward. Get that blood flow back into your back. If you stand up after, 15, 30 seconds, a minute, 2 minutes, and you have back pain, there's a serious issue going on that you need to get help with. It is not going away. It is making everything so much worse. These are more for, if you got a long car ride ahead of you, if you need, some sort of, if you have a long meeting coming up, and there's no way you're going to be able to stand up, and the boss is there, and you can't do it, incorporate these techniques. These are not going to solve back pain that comes on within 2 or 3 minutes, and you sit down, and then all of a sudden you go to stand up, and you're like, oh my gosh, I can't even move. That is a different story. It's the same background. It's still muscle, but it's muscle that it's so far gone, you're not going to be able to fix it with a few simple tricks and a few simple hacks. That really is going to take some more professional help that you definitely should seek. But doing these and incorporating these is going to make sure that even as you're receiving that help, that you are not exacerbating it when you're out of the professional help. 90% of what I do in here is teach people how to not exacerbate their back pain, what not to do, how you take care of yourself without me in the picture. It's such a big, big, big problem because people don't pay attention. Once they feel better, I'm going to go sit for as long as I can. We weren't designed to sit for that long, especially in the seats that we have. I don't care how expensive it is still not a seat that you can sit in for a long period of time. So just be careful of that.